Hello, my name is Matthew Belinsky and I'm a student at the University of North Carolina at Charlotte. And this video serves to introduce my topic of research for the semester. The topic I selected is a comparison of digital palpation versus ultrasound guided techniques for arterial cannulation. To briefly describe those two techniques, digital palpation involves actually using your fingertips to palpate the vessel and then place a catheter. For ultrasound guided, it's actually using an ultrasound probe to be able to visualize or see the vessel, and then you can also see the catheter tip as it approaches the vessel for placement. So two very different techniques to get to the same end. So why is the topic of interest to me? We have a group of 3 respiratory therapists at my facility that are involved in a core team of placing arterial lines. And amongst the 3 of us, we have some discussion about which technique is more superior to the other. There's also an affinity of techniques if you look across those who place arterial catheters. As such, there's a need to research the literature and ascertain if one is indeed better than the other in terms of success rates, etc. So to make a stance on one item being more superior to another, you have to do a comparison, and that's kind of what this study was set up as, is a comparative study in a prospective manner to be able to look at the elements compared and ascertain which technique is more superior. You have to talk about the techniques or the elements that are involved in the comparison study, and then so I've listed a few of those that we kind of looked at in terms of the studies we researched as well as our study overall. So one stick successful placement, also known as one perforation of the skin per successful placement, is an element looked at widely across the literature. Total number of sticks needed to place a cannula successfully. Efficiency or time spent placing an arterial cannula. Efficiency in terms of how long it takes to set up and perform the first stick. And then finally, and arguably probably the most important, is successful versus unsuccessful attempts. So for our study, we did 2 primary metrics and 2 secondary metrics. The primary metrics was overall success rates and one stick placements. And then secondarily, we also looked at time spent on the procedure and the number of skin perforations for successful cannulation. So in conclusion, I would like to discuss why this study is important. There seemed to be strong opinion on one technique being better than another for arterial cannulation. A single stick placement technique is supremely important for the patients for whom we provide care. And in today's fast-paced, cost-contained healthcare environment, when you're trying to save resources, efficiency seems to be gaining importance as well. And then finally, there is consideration of experience-based medicine versus that of evidence-based medicine. And by that I mean, if someone is used to using a certain technique, one or the other, that becomes their experience-based decision-making. And it gets hard for that person to be able to make a decision to try an alternate method. So it sometimes takes literature or research to ascertain which technique is better than the other for that person. So that's a synopsis of our study. I would like to thank you for your time. Goodbye.